through this residence fair. It's our pleasure to be there. Also, I'm welcoming all the medical students and participants in this streaming, and I wish would be at your expectations and fulfill all the questions and interests about our program. So, as I just said, our program is the PM&R program run by New York Medical College. It's actually one of the oldest PM&R programs in New York State and New York City in particular. It has been running for almost 20 years. So our program is, it's an advanced program, like 3 years after internship, as most of the PM&R programs. The location is in Manhattan, as I just mentioned. It's 1901 First Avenue. Sorry, excuse me, let me correct that. I said 20 years, it's 60 years actually running this program. So as I meant to say, it's one of the oldest PM&R programs in New York State and City. So it's the only program ran by New York Medical College. It has 6 sites for rotating for residents among the 3 years. So those are part of our graduated residents, to be honest, and our program attendings as well in this picture. This is those are the 4 residents of the current PGY4 in my class. The program hosts, the standard number should be 9 residents in total, 3 residents in each level, PGY2, 3 residents, PGY3, 3 residents, and PGY4, 3 residents. We had some change of those rules in the last couple of years. My class and the PGY3 class, there are 4 residents. As you can see the pictures, and the PGY2 now are 2 residents, but starting for the 2021 match, we'll go back to 3 residents at a year, and the total should be adjusted to 9 residents a year. In total, I mean, yeah, 9 residents in the program in total. Dr. Diamond Paul is our chairman right now, and also the program director. He's new to our program. He was the associate chairman in the University of Virginia PM&R program, and he's currently the chairman of our program and running the program director position as well in an amazing way. Although there is expected just to take off his burden a new recruitment for a new program director to join our faculty. Dr. Eric Ashur is the associate chairman and one of the most active attendings. And he has amazing work with us in publications and research activity. He's more than welcoming to support and stand for any research or publication activity, and he supervise that directly and make it happen. In different locations, as it's obvious here, we have in Valhalla Blythedale Children's Hospital. It's one of the most famous specialized in pediatric rehab hospitals. And Dr. Ruth Alejandro is our TBI pediatric rehab attending. And she's a mentor of a lot of our residents too, and one of the most active in the residency program activities. Dr. Suman Kumar Brahmbhatt is also our Metropolitan faculty attending, and he is the most expert in ultrasound and procedures, and he trains residents professionally and amazingly for procedures. Dr. James Fesco is our attending in one of other locations in Veterans Hospital in Castle Point. It's upstate site where we rotate over there for 2 months during PGY3 and another 2 months during PGY4 for pain management and also outpatient exposure, including EMGs and rehab clinic. Dr. Muhammad Islam is our pediatric rehab attending. He's the most specialized in pediatric rehab and has amazing tendency to educate and teach as well. Dr. Stephen Cornfield is our spinal cord injury attending in Bronx VA Hospital. Very supportive and helps with research activity as well. Dr. Adi Ndidita, he's specialized in the cardiac rehab, and he is also responsible for managing all the admissions accepted from outside locations, outside hospitals and facilities. And Kristen Morgan is our program coordinator. She's very cooperative. Her contact is also attached here to communicate about our residency if anyone has special questions. Again, I'll summarize. We have 7 hospitals. We are rotating in Metropolitan Hospital, the main site. Bellevue Hospital is where we rotate for TBI, specifically combined with other rehab, general rehab patients and SCI, but it's more intensively for traumatic brain injury patients, exposure, and it's one of the established programs, hospitals under the NYU. So this is like a communication between NYU and Metropolitan, New York Medical College programs as residents rotate there. Blythedale is the child rehab hospital I already mentioned about. Castle Point is the VA upstate. Coney Island is one of the NYCHC hospitals that we rotate in during PGY 3 and 4 for pain management and procedures. There are the rotation in Coney Island actually is the resident goes every Wednesday during his rotation to join Dr. Yap in the procedure room and get training for pain management. So main site is Metropolitan Hospital. As I said, we have 20 beds, 2 residents at a rotation runs the floor, the inpatient rotation. And but most of the times our patient average for inpatient rotation is between 12 to maximum 18. So it ends up between 6 patients to 9 patients maximum for each resident. During the inpatient, also we work as interdisciplinary team, joined with occupational therapist, speech therapist, rehab psychologist, a physical therapist, of course, and vocational rehabilitation. In the clinic, our outpatient has general rehab and specialties, specialty clinics that runs in the afternoon. So the general rehab is always every morning. In the afternoon, it's spread between brace clinic, pediatric clinic, EMGs, ultrasound procedures, and Botox injections up to the schedule. There is also the consult service. We have 2 consult rotations during the 3 years of the program. Each resident gets 1 month in Bellevue Hospital, joining the NYU residents as well in a consult rotation. And also we have our in-house ongoing during the year consult service in Metropolitan Hospital. During the consult rotation in Bellevue Hospital, the residents has the chance to join also the outpatient clinic in Bellevue, with good exposure to TBI outpatient clinic. They also get a chance to do Botox procedures and various injections. Again, there is Bellevue Hospital is one of the oldest hospitals well known in Manhattan. It used to be actually a psych rehab hospital in the past, but of course now is one of the most busy and specialized hospitals in Manhattan, known to everyone in South Manhattan. It has a trauma one center. Other than the consult service I just spoke about, this is we do also 3 months for each resident on PGY3 for inpatient rehab in Bellevue Hospital. And as mentioned before, it's basically to get good exposure covering TBI patients, traumatic brain injury, but as well there are general portion of general rehab patients and spinal cord injury. During the inpatient rehab rotation in Bellevue Hospital, there is a good chance to get exposed to the outpatient clinic once every other week, where also a lot of patients can present with spasticity, and it's a good chance to train for Botox injections. We already spoke about Blythehill Hospital. Let me be specific this time. Each resident on PGY3 spends 2 months of rotation in Blythehill Hospital in Valhalla, and it is has 2 locations that we rotate in this hospital. One part of it has exclusively TBI pediatric patients, very specialized and very rich rotation for training and education. The other part of the hospital is having the general rehab cases. Bronx VA is our rotation during PGY4. It's 1 month, pure exposure to spinal cord injury. There's a very good chance, as I mentioned with Dr. Kornfeld, to do research if someone is interested. And it's also, you join a multidisciplinary team seeing exclusively spinal cord injury patient, besides the outpatient clinic that receives a spinal cord injury, ALS, and a multiple sclerosis patient. This is the VA hospital, Castle Point Hospital in upstate New York. Very magnificent location, to be honest with you, and one of the very special rotations that we spend 2 months over there in upstate with a good residence housing. So you don't have to go back to Metropolitan for calls or support by any means while in Castle Point rotation. And there is a great exposure to, as I said, EMGs, procedures and injections, more specifically with pain spinal procedures. There is also a wheelchair clinic that runs every other week with 3 or 4 of the attendings over there that has an amazing personality and support to residents with interest in teaching. We already spoke about Coney Island Hospital. It's, as I said, NYCHSC corporate hospital in Coney Island in South Brooklyn. And it's an amazing chance to catch up with the ACGME requirement for spinal procedures, pain spine interventional procedures, and exposure to pain management. How the schedule runs, I'll try to go fast. So on PGY2, it's mainly an inpatient experience. So each resident spends from 6 to 8 months doing inpatient. During this year, you alternate with, interrupt the inpatient experience with outpatient rotations, where you see, as I said, general musculoskeletal patients, also wheelchair and prosthetics and orthotics, which we call the brace clinic, in many afternoons. During PGY3, it's the most year that residents go off-site to another locations, to another hospitals for getting the exposure to subspecialties and other specialized rehab branches that may not be intensively available in Metropolitan Hospital. But that, to be honest with you, adds a lot to the value of the program, because on each of those rotations, you deal with very well known and experts in their subspecialties and branches that we mentioned. Again, it's the year that where you go to Bellevue Hospital for traumatic brain injury inpatient experience, Castle Point, as we said, Coney Island for pain. Then also there is at least 2 months spent in Metropolitan Hospital. And finally, Blythedale for the pediatric rehab and TBI pediatric rehab. On PGY4, it's more...
5 minutes left.
Okay. PGY4, it's a good chance to get like an elective, another Castle Point rotation, and another chance for pain in Coney Island, as I said. And it's the year where we go to Bronx for the spinal cord injury. I don't want to go in details for the course schedule, but it's, what I want to say is that it's very balanced and fairly distributed, pyramidal. So first year is more like 6 to 7 average calls. Second year, PGY3, it's 4 to 5. Last year, it's like about 1 to 2 and like very few weekends covered. We have weekly didactics and lectures. Tuesdays, we cover journal clubs, board reviews, case presentations. Thursdays are more like lectures, and we have a curriculum that we stick to on Thursdays. Again, it's there is a lot of research activities and opportunities to present on famous conferences known to rehab societies as AAP, PM&R. Also, there is a chance to join the New York Society for PM&R every month that is held in the neighborhood. Those are the salaries and benefits. I would say it competes well with all other New York State programs. And we have the CIR, those are our graduates for the last year. Chances for fellowships, usually our graduates are very likely to join good fellowships. Last year we had a resident join spinal cord injury, and 2 residents went to pain management fellowships. Again, yeah, this is like briefly fellows where they usually go. It's New York City. Everyone knows the charm of New York City, so it's amazing to be around. Thank you, and I'm open for any questions.
Thank you very much. Excellent presentation. Just like with the previous program, we will try and get as many, questions as to you. Make sure you have your contact information or some sort of contact information for. You can put it in the chat if you want. You could just type it in there so that because I can probably see like underneath all these thank yous, there's probably going to be some questions they're going to get buried. So it would be good for them to be able to contact somebody at your program for this. And as I also said, that we do have our website as well.